A young woman presents to a clinic complaining of unilateral headaches that she describes as throbbing, like a hammer was hitting my head. She experiences these headaches 5 to 10 times per month, and an episode can last up to 24 hours. During the headache she is sensitive to light, sound, and smell. On a few occasions the pain has been severe enough to induce vomiting. She feels better with coffee, and by lying down alone in a dark room. Her headache is most likely which of the following types? A. Sinus. B. Tension. C. Migraine. D. Caffeine withdrawal. The answer is C. Migraine. The symptoms this individual describes are most likely due to migraine headache, migraine without aura, also known as common migraine. Migraines are diagnosed by the following criteria: more than 5 episodes, lifetime. Headache lasts 4 to 72 hours. During headache at least one of the following: nausea, vomiting, photophobia or phonophobia. Headache has at least 2 of the following characteristics: unilateral, moderate or severe pain intensity, pulsating. Aggravation by normal physical activity, may cause avoidance of normal activities of life. Not attributed to another disorder. A 37-year-old man comes into the clinic for chronic headaches. He describes his headaches as in his forehead and temples bilaterally, occasionally wrapping around his head toward his neck. Pain is rated as a 4 out of 10. He has these headaches around 3 times per week. No photophobia with his headaches, no nausea or vomiting. Headache feels better when he presses on his scalp. When asked to describe the sensation of the headache, he replies that it's like a band around his head. These headaches are not preventing him from normal activity. These are most likely what type of headache? A. Cluster headaches. B. Ocular migraine. C. Classic migraine. D. Tension headaches. The answer is D. Tension headaches. The symptoms described by this individual make tension headaches the most likely diagnosis. Tension headaches are defined by the following criteria: minimum of 10 episodes occurring on less than 15 days per month for at least 3 months. Headaches last from 30 minutes to 7 days. Headache has at least 2 of the following qualities: mild or moderate intensity, bilateral, pressing or tightening, non-pulsing, quality, not aggravated by routine activities of daily living. Both of the following: no nausea or vomiting. Either photophobia or phonophobia, but not both. A 21-year-old male presents to clinic for extremely painful headaches. Pain is felt above the left eye and described as a 9 out of 10. Headaches are short, most episodes last for 30-45 minutes, and always on the left side. He notices that during an episode, his left eye will become red and watery, and his nose will run on the left side. He has up to 3 episodes per day. During a headache he will become agitated and restless, and will pace, groan, and hit the wall or floor with his fist. He is very concerned that he may have a brain tumor, meningitis, or some other serious condition. His headaches are most likely which of the following types? A. Tension headache. B. Migraine without aura. C. Migraine with aura. D. Cluster headache. The answer is D. Cluster headache. The presentation of this patient's headaches would make cluster headache the most likely diagnosis. Cluster headaches are defined by the following criteria: at least 5 attacks, severe unilateral orbital, supraorbital or temporal pain lasting 15 to 180 minutes. Headache is accompanied by at least one of the following: ipsilateral conjunctival injection and or lacrimation, ipsilateral nasal congestion and or rhinorrhea, ipsilateral eyelid swelling, ipsilateral facial sweating, ipsilateral miosis or ptosis, restlessness or agitation. Attack frequency ranges from every other day to 8 per day. Not attributed to another disorder. Which of the following is not a common trigger for migraine headaches? A. Caffeine. B. Medication. C. Food allergies. D. Lack of sleep. The answer is A. Caffeine. While caffeine may be a migraine trigger for certain individuals, in the majority of people who experience migraine headaches, caffeine provides significant relief of pain. This may be due to its antagonizing adenosine receptors, which has the effect of cerebral vasoconstriction. Caffeine withdrawal, however, is a common cause of headaches and may trigger migraine in susceptible individuals. Other common migraine triggers include food allergies, medications, bright lights, stress, lack of sleep, hormone fluctuations, strong odors, alcohol, and certain types of exercise. Which of the following seizure types is characterized by a brief loss in muscle control, often resulting in a fall or collapse, in the absence of spasm or rigidity? A. Myoclonic seizure. B. Tonic-clonic seizure. C. Absence seizure. D. Atonic seizure. The answer is D. Atonic seizure. Atonic seizures are characterized by brief, 2 to 15 second, loss or lapses in muscle control, resulting in sudden relaxation of the neck, legs, or whole body. This seizure type frequently causes injury due to falls or head trauma. There may be spasm or twitching at some point during an atonic seizure, but they generally present without any form of rigidity or clonus, unlike tonic-clonic and myoclonic seizures. Atonic seizures differ from absence seizures in that an individual experiencing absence seizures will generally only experience a loss of consciousness, without an accompanying loss of muscle control.